My name is Dr. Daniel Fox, a licensed psychologist in the state of Texas and an expert in the area of personality disorders. And today I wanted to talk about BPD and high-risk situations. Now this video is going to cover high-risk situations for individuals with borderline personality disorder, BPD, and those with BPD traits. Now these high-risk situations include interpersonal situations, negative emotions, life events, cognitive distress, and cues and urges. Now, learning about these high-risk situations may help you build your awareness and insight into each of these areas, and can also help you find alternative behaviors to help you manage them better. So let's get started. So the first high-risk situation that we're going to talk about, that's the high-risk interpersonal situations. Now, this tends to involve a lot of conflict and is linked to specific individuals and associated thoughts, feelings, and beliefs. Now, can you think of some of these for you? Can you think of some people that when you're in these situations, it's really hard to contain yourself, it's really hard to not get frustrated, feel bad about yourself, have some of that core content get ignited? Those are some high-risk interpersonal situations. A lot of these high-risk situations, they typically occur when you feel like you've lost support of a friend or a loved one, perhaps a family member, and you sort of this feeling of worthlessness or abandonment or rejection starts to build inside. And that's when it becomes a high risk. So what is it a high risk for? It's a high risk to engage in maladaptive behaviors, to go back to perhaps default behaviors, which I've done a video on that as well, to go back to those behaviors. So it makes it harder to use those adaptive strategies that you're trying to use and implement to do it differently. The next high-risk situation are negative emotions. Now, negative emotions, these include anger, anxiety, stress, guilt, loneliness, helplessness, shame, and feelings of being trapped, and that's just to name a few. With BPD, these emotions tend to overwhelm you. They cause you, it's a hard time seeing anything adaptive, seeing that things could be positive, whether it's about yourself, the person that you're with, or the situation that you're in. So these negative situations become really intensive, and they tend to narrow that view, so it's really hard to see alternatives and also to implement those new adaptive behaviors that you're utilizing to have better control over yourself, to have better control over your perspective, and to have a greater idea and perspective of what is going on around you. The next high-risk situation are life events. Now, life events, these include divorce, unemployment, death of a loved one, could be end of a relationship, personal injury, financial difficulties, imprisonment, or anything that can cause significant physical or psychological pain and discomfort. And from that, or another high-risk situation is also what's called cognitive distress. Now, cognitive distress, this involves negative thoughts and memories. You can't get out of your mind that this issue or this sense of fear, danger, sometimes it's past trauma, sometimes it's other stressful events that are bothering you, that are coming up. It causes this cognitive distress, and that comes with it all this intense anxiety and uneasiness, agitation, and so on again, and it's bringing you back to go to those old maladaptive behaviors that you used to use instead of using new and adaptive behaviors to help yourself. And lastly, we're going to talk about cues and urges. Now, these are those things in the environment that influence those thoughts, beliefs, and behaviors that you have, feelings and behaviors. And this can include drug paraphernalia, pictures of hurtful people from your past, items that you use to harm yourself, places of past loss or trauma. These are those things that really bring back all those memories, that really help to push those emotional buttons. I'll put a link for that video here on emotional buttons and triggers, and that bring all of that up for you. And so it's these cues and urges. And I think what happens is a lot of folks with BPD, and even though those without, that we don't stop and think, okay, what are these high-risk situations? What are these things that contribute to my emotional buttons, to my triggers, to my having difficulty getting along with my boss, my significant other, my friends, my spouse, whoever it is? It can become very, very difficult. Now let's take a moment and think about each of these and identify the people, places, and things that fit for you. Are these triggers or emotional buttons for you, right? What are they? Which ones are more salient, more intense for you? How do you feel when you just think about them, right? Many don't feel too good thinking about these things, and it can bring up a lot of feelings just now listening to this video, and it's okay to pause it, take a break, come back when you're ready. This video is not going anywhere, so it's okay to do that. And many folks, what they want to do is they want to block out a lot of these high-risk situations, a lot of these high-risk factors that are in their life. But what happens is that if you don't face it, it kind of gives that BPD a little more power. And when we talk about that BPD, we're talking about that cluster of core content that drives surface structure behavior for you to engage in maladaptive patterns that feed this belief you have of yourself, that abandonment, worthlessness, rejection, loss, and all those other things. And it is confusing for a lot of folks. And these high-risk situations can contribute to it. But if you can examine it, and you don't have to do all of them at the same time. Break them up. Do the one that isn't that bad and slowly work up to the ones that are maybe a little more intense for you. You can do this with a mental health provider as well. That's great to have some support, someone who can help you examine this, use adaptive strategies to control it. Okay? And that's really important for you to do that as well. Okay? And like with a lot of my clients, what I try to do is I try to empower them to master their response. And we work to identify alternative behaviors to engage in. That's those adaptive behaviors. Some of those adaptive behaviors that are most effective for my clients, I'm going to give you a list, and that includes reaching out to a safe and positive friend or loved one, someone who you know is not going to encourage maladaptive patterns, responses, make things worse. You can remove yourself from high-risk situations, right? There's a lot of instances where you can, some you can't, I understand that, but there are also some that you can. And then make a list of all the benefits of not falling into your negative patterns. Give yourself reasons to use adaptive strategies. Give yourself clear and defined steps and strategies and understanding for you not to fall into those old maladaptive patterns. What's the benefit? There is a benefit. And then smelling some essential oils can help a lot. Lavender, cinnamon, cedarwood. This helps you refocus and calms you down. So you can get a little bit of essential oil, put it on a washcloth or a little, I don't know, little piece of cloth, whatever you want, and just pour it on there. And it helps you center. It helps you calm down, slow down, because your BPD wants you to keep driving, right? It wants you to keep falling into those maladaptive behaviors that strengthen that BPD, because that's what your BPD wants to do. But you don't have to do that. You can grow beyond your BPD. You can do things differently. And it is possible to do that. And understanding these high-risk situations is a way to do that. And it's really easy to sort of discount some alternative behaviors, and it might be scary to consider doing things differently or learning about and challenging those BPD patterns, but it's important to do this so you can grow beyond it. Okay, and I hope that you found this video helpful, and if you'd like to learn more about high-risk situations and alternative behaviors, it's in my workbook, the Borderline Personality Disorder Workbook. And check it out. And I appreciate your time and attention, and I hope you found this video helpful. Thanks a lot, and have a good day. Bye-bye.